Asante. Yeah, so we are looking at the skin disorders, and of course, as we always do, we have to always a bit of anatomy, because when you understand the anatomy, then it will help you understand when the condition. So we can see there the skin, one of the diagram among many others that we look at. You can see we have done this in anatomy 1, where we have the epidermis and dermis. So mainly for the skin, we have the epidermis, and then we have the dermis, and then we have an hypodermis, that is a subcutaneous, just below the skin. And after the subcutaneous tissue, then that is when you have the fascia. It's with a place where there are muscles, and the fascia is the one with cover muscles. And so you see the various appendages. We talked of appendages of the skin, like for example the hair follicle. You can see the hair shaft. You can see the gland. You can see, I think it's just reminding ourselves of the anatomy that we have talked about, because this will be important for you to be able to remember. You can see there the dermal papilla. I think when you read through, you realize a lot of things. You can see there. You realize that the epidermis has, for the skin, you can talk skin that is thick skin, or you cannot talk of others that is thin skin. For thick skin, usually the epidermis will be up to 5 layers, but for a thin skin, maybe 4 layers. And you can see one of the important layer with the that, and then as they mature, they are pushed upward, and conium. And we know the skin is stratified. We call it a conified, or you can say keratinized, stratified squamous epithelium. Because the cells towards the surface, they become flat. So they are squamous, they are flat. And that is why it is stratified. That is the epidermis. Then, of course, we have the dermis, where mainly we have those like Meissner corpuscle, we have the nerves, we have the blood vessels. So remember that the epidermis, really, there are no blood vessels that get there. So mostly nutrition to the epidermis would be through diffusion from the blood vessels in the dermis. And that is why you see, as the cells are being pushed up, they lose their nucleus, they become keratinized. And that is why we have keratin that is covering our skin. Basically scale-like cells that have no nuclei. And when we move on to the next, we can see just the skin again, just trying. So as I said, it's important that we get to understand this anatomy. Then it will become easy even to understand the diseases that affect the skin. Again, you can see the epidermis, which is basically, which we said is stratified squamous epithelium. Then we have the dermis, and we have a dermis, we say papillary dermis, and we have reticular dermis. Yeah, and then you can see the papillary one. You can see those corrugation, and then you can see the blood vessel. You can see the sebaceous gland. You can see the erector and all that. And I think we are, because these are tissue. Mostly that is where the fat, the adipose tissues. I say the skin can be either, which usually will have 5 layers, and then we have probably 4 layers. And we can see this is mainly looking at the layers in the epidermis. You can see, for example, there is the stratum basale. You can call it germinativum. Those are now the cells that start there, and they mostly will appear cuboidal. Over they're pushed out, they'll become the stratum corneum, where you have the stratum. So you can have stratum basale, you have stratum spinosum, stratum lucidum, and I think it's good that you see in the issue talked about, especially those changes depending on the trauma to the skin. You layer, see it as all those layers that finally you have stratum corneum. And some people, some books or some people will call it, conified layer. Yeah, and this keratin is what actually the material that also makes things like the nails and even the the horns, for example, in animals is made of keratin. Yeah, so that one is basically in thick skin, which will have at least 5 layers. So we say for maybe up to just 4 layers. And then that's an electron micrograph. I know in first year we talked about the different types of microscopes, where we talk about electron, and there will be one that is scanning and so on. So you need to go back and remind yourself those types of electron microscope. And so you can even get to know which one was used in this case, probably scanning, because you can see it appears colored. And then from this, you can see those squames, those flat cells. That is now the keratin at the very surface. And of course, you can see up to where the epidermis ends, and then you can see that the dermis. That is under an electron microscope, electron micrograph. Just emphasizing the layers of the epidermis again, you can see the stratum germinatum, which is basically stratum basale. That is where the cells start. And you can see there is the melanocyte. That is the cell that produces the melanin. That gives the skin color. And then you see increasingly as we rise up, as the cells are being pushed to the surface, they become progressively flatten out and loose. Eventually, by the time they come to the stratum corneum, or you can call it the conified layer, they've lost the nucleus. So they become just flattened cells. And that is why we said last time when we talked about epithelium in first year, we talked about the naming of stratified epithelium, where we said you look at the cell that is topmost layer. So if the topmost layer is flattened, that is why for skin we say is keratinized, stratified squamous epithelium, because the uppermost cells are flat. Yeah. Unlike when you can see in this case, the basal layer, the stratum germinatum, the cells are actually almost more or less cuboidal. So as you move on, you can see the carotenoids. Keratocytes are basically the cells of the epidermis. Yeah, so you can see those layers as you go up. Again, just looking at the epidermal cell. So looking at the epidermis, how the cells grow, you can see it. So they are pushed up, they start becoming squamous, they flatten out as you move up. That finally to the granule. Finally, granular cells have granules. You can see in them they are what we think could granule. And then we have the conified or horny layer. You can call it keratinized layer at the very top. So that is how it evolves. It starts the basal layer. As they move up, they are flat. And you feel so the lunch organ, and we already talked in